Hello everyone and welcome to my channel. Here is Angelos Roussos and today's topic is about squat. We're going to discuss about the most optimal squat technique, the importance to perform squat exercises, and generally to answer you some common questions and provide you with some useful tips. Answering the first question about which muscles have higher contribution on squat exercise, there are studies referred that using electromyography and comparing the three most common type of squat, half squat in 45 degrees angle, parallel squat in 90 degrees angle, and deep squat in 125 degrees angle, resulted that there is higher contribution for gluteus maximus in deep squat comparing with half squat, which there is higher contribution for vastus medialis. When we are doing an eccentric phase, which is the ascension from a squat, there are some muscles that have the most relative contribution. These muscles are vastus medialis, vastus lateralis, and rectus femoris, bicep femoris and semitendinosus, soleus, and gluteus maximus, plus two more muscles, which are piriformis muscle and gluteus medius, that recruited to aid in hip extension. Finally, when we are talking about the load we use when we are performing a squat exercise, we have to interpret that altering the load and using maximal efforts, we alter the recruitment patterns, which means that we are not using only agonist action muscles, but also neutralizer action muscles that can help to maintain our body in correct position and complete the full motion squat. When it comes to the most optimal squat technique, we have to consider our foot positioning. Firstly, we have to keep a quite wide stance, which is greater than or equal of our shoulder width. We have to keep our heels on the ground and ideally to keep our knees behind our toes. Finally, when we are performing a squat exercise, our lordotic curve of our lumbar spine is maintained with a forward or upward gaze. And this is an example of an optimal squat exercise with a correct technique. It's the most important. Squat, as most people know, is a well-known exercise to strengthen the muscles of our lower limb. Biomechanically, is a closed chain movement exercise requiring simultaneous extension patterns of our ankle, knee, and hip joints. The squat exercise is a versatile exercise, and specialists among the world agree that squat is among the top 3 prescribed exercises when it comes to sports training, rehabilitation, and prehabilitation. There are discussions between deep and half squat with athletic performance. There are controversial beliefs comparing these two types with jumping and sprinting, which are very essential skills in a lot of different sports. A lot of studies though support that half squat is more essential when it comes to athletic performance, and the reason why is about the similar hip and knee joint movement in sprinting and jumping respectively. But taking into consideration all the aspects, Both types of squat provide benefits. The deep squat provides a generally conditioning benefit and performance improvement, while the half squat provides specific conditioning benefits and of course performance improvement when it comes to sprinting and jumping, as I mentioned before. Another positive aspect about the squat exercise is about the benefits provided on daily living individuals. The squat exercise, due to its ability to mimic many different activities, it's an ideal choice for general health and fitness training programs. For instance, research has shown that using simple bodyweight squat as part of resistant strength training intervention improve performance of elder individuals on their daily living. Moreover, the squat, as part of a good balance resistant training program, can build lower limb strength and lean mass, helping counteract age-related pathologies such as sarcopenia and dynapenia. Finally, what about risks? This is a very essential question, and you have to be very careful when it comes to deep squat in order to prevent from a knee injury, especially if you feel or you have any disturbance with your knees. Of course, when you are performing a deep squat, there are forces utilized inside your knee joints. There are three types of risks when you are performing a squat exercise. For that reason, if it's not your sport's nature to perform a deep squat, it's better to perform a more functional range of motion squat, which is between 0 and 50 degrees angle. The reason why it's about the forces that can affect your knee joints, more specific, your posterior cruciate ligament, the patellofemoral joint, and the tibiofemoral joint. These forces increase with the increment of knee flexion. For that reason, be careful when you are performing a deep squat, especially if you have any knee medical history. Okay, to recap today's video and what we actually learned from this video. Firstly, there are a lot of different muscles on our lower limb that are engaged during a squat exercise. Secondly, correct posture and technique are the key for more efficient performance and injury prevention. Third, squat provide a lot of benefits both in athletic performance and daily living. And last but not least, protect your knees if it's not essential to perform a full depth squat. So guys, these were just some tips in order to understand more about simple daily movement in our lives and to provide you with some answers in order to help you understand this exercise if it could possibly help you with your sport or your daily living. I hope that you enjoyed this video and you found it useful eventually, and I'll see you soon with more tips and knowledge in order to learn and understand our own body. Cheers!